Good day, everyone. I'm Nicole K. Aldolor, and the report of our group is all about the nutrition for infants. So, as we all know, infancy is the period from birth to 1 year or 12 months. So, excluding fetal growth, growth in the first year of life is more rapid than at any other time in the life cycle. Birth weight doubles by 4 to 6 months of age and triples by the first birthday or 12 months. Also, length increases by approximately 10 inches during the first year. Adequate calories and nutrients are needed to support the unprecedented rate of growth. Recommendations for the amount of calories, macronutrients, vitamins, and minerals infants should consume are based on the average intakes of healthy, full-term newborns who are exclusively breastfed by well-nourished mothers. Although the total amount of calories and nutrients are generally far less than what adults need, the infant's needs are much higher per kilogram of body weight. Proportionately, infants use large amounts of energy and nutrients to fuel their body processes and growth. So, talking about breast milk, it is specifically designed to support optimal growth and development in the newborn, and its composition makes it uniquely superior for infant feeding. So, from the word superior, it is the ideal food for infants, for it is safe, clean, and contains antibodies which help protect against many common childhood illnesses. Breast milk provides all the energy and nutrients that the infant needs for the first months of life, and it continues to provide up to half or more of a child's nutritional needs during the second half of the first year and up to one-third during the second year of life. So, breastfeeding is credited with numerous potential health benefits for the infant, including lower risk of otitis media, upper respiratory tract infection, lower respiratory tract infection, asthma, atopic dermatitis, or often referred to as eczema, which is a chronic or long-lasting disease that causes inflammation, redness, and irritation of the skin. It is a common condition that usually begins in childhood. However, anyone can get the disease at any age. Next is gastroenteritis, which is an inflammation of the lining of the stomach and intestines. Obesity, celiac disease, which is a chronic digestive and immune disorder that damages the small intestine. So the disease is triggered by eating foods containing gluten. Next is type 1 and type 2 diabetes, certain types of leukemia, and sudden infant death syndrome. Although many of these benefits are linked to breastfeeding for 3 months or more, some benefits occur with any duration of breastfeeding, such as the reduced risk of obesity and type 2 diabetes. Next is the composition of breast milk. So, the protein content of breast milk is adequate to support growth and development without contributing to an excessive renal solute load. So the majority of protein is easy to digest whey. So this whey is one of the primary proteins found in dairy or dairy products. Next is breast milk contains small amounts of amino acids that may be harmful in large amounts, for example, the phenylalanine, and high levels of amino acids that infants cannot synthesize well, such as the taurine. Next is the fat in breast milk is easily digested because of fat digesting enzymes contained in the milk. So these fat digestive enzymes in the milk is the lipase, which is required for newborns to fully digest and use the fat in breast milk. Also, lipase breaks down milk fat and separates it into three fatty acids and glycerol, which is a type of carbohydrate. Next is the content of linoleic acid is high. So this linoleic acid is an essential fatty acid. Next is the high level of cholesterol is believed to help infants develop enzyme systems capable of handling cholesterol later in life. Breast milk contains amylase, which is a starch digesting enzyme, which may promote starch digestion in early infancy when pancreatic amylase is low or absent. Next is breast milk contains enough minerals to support adequate growth and development, but not excessive amounts that would burden the immature kidneys with a high renal solute load. Next is the minerals are mostly protein bound and balanced to enhance bioavailability. So, for instance, the rate of iron absorption from breast milk is approximately 50% compared with about 4% for iron fortified formulas. So, zinc absorption is better from breast milk than from either cow's milk or formula. All vitamins needed for growth and health are supplied in breast milk, but vitamin content of breast milk varies with the mother's diet. Next is the renal solute load of breast milk is approximately one half that of commercial formulas. The low renal solute load is suited to the immature kidney's inability to concentrate urine. Lastly, although they are more abundant in colostrum, antibodies and anti-infective factors are present in mature breast milk. So, bifidus factor promotes the growth of normal gastrointestinal flora, for example, the Lactobacillus bifidus that protect the infant against harmful GI bacteria. Next is teaching points for breastfeeding. So, this is very important. First is the infant should be allowed to nurse for 5 minutes on each breast on the first day to achieve letdown and milk ejection. So by the end of the first week, the infant should be nursing up to 15 minutes per breast. Next is in the first few weeks of breastfeeding, the infant may nurse 8 to 12 times every 24 hours. Mothers should allow offer the breast whenever the infant shows early signs of hunger, such as increased alertness, physical activity, mouthing, or rooting. After breastfeeding is well established, 8 feedings every 24 hours may be appropriate. Next is the first breast offered should be alternated with every feeding so both breasts received equal stimulation and draining. Even though the infant will be able to virtually empty the breast within 5 to 10 minutes, once the milk supply is established, the infant needs to nurse beyond that point to satisfy the need to suck and to receive emotional and physical comfort. Next is the supply of milk is equal to the demand. So the more the infant sucks, the more milk is produced. Infants aged 6 weeks or 12 weeks who suck more are probably experiencing the growth spurt and so need more milk. And also, water and juice are unnecessary for breastfed infants in the first 6 months of life, even in hot climates. Next is early substitution of formula or introduction of solid foods may decrease the chance of maintaining lactation. Infants weaned before 12 months of age should be given iron fortified formula, not cow's milk. So both feeding the infant more frequently and manually expressing milk will help to increase the milk supply. Lastly, breast milk can be pumped, placed in a sanitary bottle, and immediately refrigerated or frozen for later use. Milk should be used within 24 hours if refrigerated or within 3 months if stored in the freezer compartment of the refrigerator.
Infant formula, baby formula, or simply formula is manufactured food designed and marketed for feeding to babies, infants under 12 months of age, usually prepared for bottle feeding or cup feeding from powder or liquid. Dif- FFDCA, or Federal Food, Drug, and Cosmetics Act, defines infant formula as food which purports to be or represented for special dietary use solely as a food for infants by reason of its simulation of human milk or its sustainability as a complete or partial substitute for human milk. Infant formulas may be used in place of breastfeeding, such as occasional supplement to breastfeeding, or when exclusively breastfed infants are weaned before 12 months of age. Term formulas contains cow milk, protein, and lactose, and are made to resemble human milk. The Infant Formula Act regulates the level of nutrients in formulas, specifying both minimum and maximum amounts of each essential nutrient. Almost all for formula used in United States is iron fortified, a practice that has greatly reduced in risk of iron deficiency in older infants. Because of minimum recommended amount of each nutrients is more than amount provided in breast milk. Nutrient supplements are unnecessary. There are no data to support the use of one term formula over another. They are all nutritionally interchangeable. Preterm formula is intended for infants born before 34 weeks of gestation, designed to promote catch-up growth. These formulas are higher in calories, protein, calcium, magnesium, and phosphorus than routine formulas. Hospital discharge before 34 weeks of gestational age is rare, so these formulas are typically used only in the hospital. Enriched formulas for infants 34 to 36 weeks of gestations. These formulas contains more than calories than term formulas.
Good day everyone, my name is Athena Shaila Amalabado and I'm going to report about milk formulas for the baby. First is soy formula for infants with galactosemia or congenital lactase deficiency or from strict vegan families. Congenital lactose deficiency is a genetic disorder which infants are unable to break down lactose in breast milk or formula. It can result in severe diarrhea, develop severe dehydration, and weight loss. So basically, soy formula is also lactose free. Next is corn-based carbohydrate for infants with congenital or primary lactose deficiency, galactosemia, or gastroenteritis. Galactosemia affects the body's inability to convert galactose to glucose. Next is hypoallergenic and non-allergenic formula for infants with an allergy to milk protein. Although hypoallergenic infants are made with cow's milk, they are processed so that allergy-causing protein is broken down in order to be digestible for the infants. Example of hypoallergenic and non-allergenic formula is Similac Alimentum. Next is anti-reflux formula for infants with gastroesophageal reflux or GERD. So this formula is for dietary management of babies with significant reflux or spitting up. In this condition, the stomach acid repeatedly flows back into the esophagus, making the babies spitting up. An example of anti-reflux formula is the SMA anti-reflux. Last but not the least, specialty formulas for infants with inborn errors of metabolism such as PKU or maple syrup-urine disease. Maple syrup-urine disease is a condition wherein the body cannot process the amino acids. So these specialty formulas is for children who needs high quality and balanced nutrition.
The amount of formula provided per feeding and the frequency of feeding depend on the infant's age and individual needs. Overfeeding is one of the biggest hazards of formula feeding. Caregivers should recognize that infants cry for reasons other than hunger and should not be fed every time they cry, nor should an infant be forced to finish his or her bottle. To avoid nursing bottle caries, infants and children should not be put to bed with a bottle of formula, milk, juice, or other sweetened liquid. Here in Table 12.2 is the general parameters for formula feeding. For age 1 month, the number of feedings in 24 hours should be 6 to 8 times, and the amount per feeding should be 2 to 4 ounces. For 2 months, the number of feedings in 24 hours should be 5 to 6 times, and the amount per feeding should be 5 to 6 ounces. And for the 3 to 5 months, 4 to 5 times in 24 hours with an amount of 6 to 7 ounces per feeding.
Good day everyone, I am Kazel Jane T. Montoya and I will be going to discuss about the infant feeding and obesity. So many overweight infants remain overweight as children. Childhood obesity has been known long as a predictor of adult obesity. So being too heavy can delay the physical development of a baby, especially in crawling and walking. So that is why if the infant is chubby or overweight in his or her infancy stage, then he or she will remain overweight as she or he reach the stage of adulthood. So because diba sometimes we find baby na cute if they're if they're chubby. So it's not good because they should have the required weight for their developmental stage. So yes, they may be cute, but it's not healthy for them. Next is research suggests that the critical period of establishing dietary intake patterns, eating habits, and food preferences begins in infancy, and although inconsistent, may be set as early as 2 years of age. So early nutrition can have a long-term effect on growth and metabolic outcome and long-term health of an infant. So correct feeding in early years of life is particularly important due to its role in lowering the morbidity and mortality. It also helps in reducing the risk of chronic disease throughout their lifespan and promoting regular mental and physical development. So strategies to reduce rates of overweight in very young children are gaining greater attention, particularly parental feeding practices that may promote obesity, such as inattention to hunger and satiety cues, or using, controlling, rewarding, or restrictive feeding. So, di ba, minsan sa mga pinsan natin, ma-notice natin na yung mga parents nila, they sometimes mag-isabihan nila yung bata na, o sige, gawin mo yan kasi i-rewardan kita ng ganito, bigyan kita ng chocolate, sige, magpunta tayo sa Jollibee, ganito, ganyan. Minsan, yung mga mama natin, di ba, or yung mga titas natin na may mga baby, ginasabihan na, uy, hindi dapat, huwag mo kainin yan, huwag mo ganito, ganyan, huwag ganito, ganyan, dapat ito lang kainin mo, dapat ganito lang. So, tama naman yon to control the food na ginabigyan natin sa mga anak natin, but sometimes we know we should have the limitations lang. We give the food na alam natin na maka-help for their further development, especially on their growth, na healthy para sa kanila and nutritious para sa kanila. Okay din naman yung magbigay tayo ng sweets, yung mga ganyan, small rewards, pero wag natin yung parang always na ganun na lang yung ginagawa natin para yung pilitin natin yung bata na gawin ganito ganyan, or minsan pagbawalan pa natin kasi feel natin ganito ganyan, yung bad sa kanila. Pwede naman yun basta we control lang and we give limits sa mga ginabigay natin sa kanila, basta alam natin na yung binibigay natin sa kanila is para lang sa yung sapat lang, and yun lang yung required na pagkain para sa kanila.
Breastfeeding duration and/or exclusivity has been inversely related to the rate of weight gain during infancy and with weight and risk of overweight and obesity in toddlers and preschoolers. So, The exclusive breastfeeding recommended is at least 6 months of age. Minsan kasi nagkakaroon ng weight gain yung bata that can be result in obesity. Kailangan nating tandaan na overfeeding sa mga bata can be one of the greatest hazard for formula feeding. Never force the infant to finish one bottle or take more than he or she wants. Formula-fed infants generally grow quicker than breastfed infants during infancy. And at 1 year of age, formula-fed infants tend to have a higher body weight and weight for length. Formula-fed infants have different feeding patterns than breastfed infants, which may impact later obesity risk. Formula-fed infants have lower frequency of meals and a longer interval between feedings than typically found in breastfed infants. So na-observe naman natin sa mga bata na yung mga breastfeed and yung mga nagpa-formula fed is malaki talaga yung agwat. Mabilis yung paglaki ng mga nagpa-formula fed kaysa sa nagbe-breastfeed. The nutrient content and taste of human milk vary. It is postulated at early exposure to difference in taste may program infants to different food selection and dietary habits later in life compared to formula-fed infants.
So next is most infant formulas have slightly higher calorie density than breast milk, and calories consumed per kilogram of body weight in formula-fed infants ages 3 to 12 months have been reported to be approximately 10 to 18% higher than breastfed infants. So according to this, infant formulas have higher calorie content than the breast milk produced by the mother. So even more striking than calorie density is a difference in protein intake. So formula-fed infants consume 55 to 80% more protein per kilogram than breastfed infants. So some proposed mechanisms by which a higher protein intake may predispose infants to obesity later in their life and includes its effect on energy expenditure, insulin secretion, and human growth hormone secretion. So according to this, or according to the PowerPoint, it is not advisable to let the infant only consume infant formulas, and instead we must balance them when giving them infant formulas and breast milk of the mother, because like I have said, infant formulas have higher calorie content than the breast milk produced by the mother, so it will cause them to be obese later in their life. So next is studies suggest breastfeeding during early infancy is associated with greater appetite regulation later in childhood, and breastfed infants are not subjected to parents urging them to finish the bottle. So according to these studies, breastfed infants have greater or higher appetite than infant formulas consumed infant. So, and breastfed infants are subjected to parents urging them to finish the bottle. So this means they can at least try or independently try finishing the bottle of milk on their own. So next is breastfed infants are less likely to be given complementary foods at less than 4 months of age, and late introduction of complementary feedings may protect them against overweight. So the late introduction of complementary foods or complementary feedings may protect the infant against obesity or having them overweight.
Good day everyone, I am Stephen Rady Hali. Today I am going to discuss the teaching points for formula feeding. One of the greatest hazards for formula feeding is overfeeding. Never force the infant to finish a bottle or to take more than he or she wants. Signs that an infant is finished include biting the nipple, puckering the face, and turning away from the bottle. We shouldn't force the infant to finish a bottle or to take more than he or she wants, because it couldn't turn into overfeeding, or it will develop indigestion. Indigestion is these are the pain or discomfort in your abdomen The symptoms usually appears soon after eating or drinking, such as feeling full or bloated. Next is to discourage the misconceptions that a fat baby, a healthy baby, a good parents. We should discourage the misconception. For example, if your baby is fat, it means they are healthy. If they are healthy, the parents are also good. So we should avoid that misconception, because if the baby is fat, that's considered obesity. So which means they are not healthy, and it also depends on how the parents feed them. Each feeding should last 20 to 30 minutes. Because babies are often sleepy, this length of time may require a patience and persistence. Formula may be given at room temperature, slightly warm and direct from the refrigerator. However, always give formula at approximately the same temperature. Because giving a formula at room temperature, this provides a comfort during feeding, and warm milk is also easier for the baby to digest. Spitting up of a small amount of formula during or after the feeding is normal. Feeding the infant more slowly and burp more frequently to alleviate or to help alleviate spitting up. Hold the infant closely and securely. Position the infant so that the head is higher than the rest of the body. Next, avoid jiggling the bottle or making any extra movements that could distract the infant from feeding. Check the flow of formula by holding the bottle upside down. A steady drip from the nipple should be observed. If flow is rapid because of a too large nipple opening, the infant may overfeed and develop indigestion. If the flow rate is too slow because of a too small nipple opening, the infant may be tired and fall asleep without enough taking a formula. Discard any nipples with holes that are too large and enlarge holes that are too small with a sterilized needle. And the next is to reassure caregivers that there is no danger of spoiling an infant by feeding him or her with the infant cries for a feeding. It doesn't mean that you are spoiling that infant, it's because of feeding them. It's because that's the way on how to comfort the infant when they are crying. Birth the infant halfway through the feeding at the end of the feeding, and more often if necessary to help get rid of air swallowed during feeding. Burping can be accomplished by gently rubbing or patting the infant back as he or she is held on the shoulder, lies on his or her stomach over the caregiver's lap, or sit in a upright position. The purpose of this is to get rid of air swallowed during the feeding. And then next is, after the teeth erupt, the baby should be given only plain water for a bedtime bottle feeding. Never prop the bottle or put the infant to the bed with the bottle. So never put the baby to bed with a bottle, as it can cause baby bottle tooth decay. There are so many reasons why we shouldn't place the infant to the bed with a bottle. The first one, the baby might be choked. Babies who fall asleep while drinking from a bottle can draw liquid into their lungs and choke. The second one is the baby might have a chance of ear infections.
So, complementary foods introducing solids. Introducing complementary foods earlier than 4 months of age is associated with early or excessive weight in infants, preschoolers, and toddlers. Parents are urged to delay introducing solid foods until the infant exhibits developmental readiness. So, complementary food, it is either a food or drink other than breast milk or infant formula. Example given are the infant cereals or oatmeal, fruits, vegetables, water, and etc. So physiologically, complementary foods become a necessary source of nutrients at around 6 months of age, because neonatal nutrient reserves become depleted and concentrations of some nutrients in breast milk, such as zinc, decline over time. Then infants are the 0 to 1 year of age, and these are the child in their first period of life. So developmentally, most infants exhibit readiness in spoon feed around 4 to 6 months of age as reflexes disappear, head control develops, and the infant is able to sit. Over time, control of the head, neck, jaw and tongue, hand-eye coordination, and the ability to sit, grasp, chew and drink, and self-feed evolve. The eruption of teeth indicates readiness to progress from strained to mash to chaff fine to regular consistency foods. So for both breastfeed and formula-fed infants, iron-fortified infant cereal is traditionally the first solid food introduced. To increase the likelihood of acceptance, parents are urged to give a small amount of formula or breast milk to take the edge of hunger until before beginning the cereal. So, iron fortified infant cereal are recommended until the infant is 12 to 18 months old because the iron in the cereals is absorbed more readily than that from other cereals. So iron fortified infant cereal, this is an important source of iron starting at 6 months of age, and the use of iron fortification is an effective and safe way to help meet an infant's dietary needs. So iron is necessary to make hemoglobin, which carries oxygen and red blood cells to all parts of our body. And iron also supports proper neurological development during infancy and early childhood. So next is traditionally the order of foods introduced after iron fortified cereals was vegetables, fruits, meats, and then eggs. So the order is no longer considered important, and some experts recommend offering meat as one of the first complementary foods because of its iron and zinc content. Although easily chewed red meat such as baby food meat and home pureed cooked meats are recommended, relatively few infants under 9 months are fed baby or non-baby meats of any kind. So commercial baby food dinners are more commonly consumed, and chicken and turkey, which provides less hem iron than red meats, are the most popular meats, followed by hot dogs, sausages, and cold cuts, which are higher in fat and sodium and lower in iron and zinc than plain meats. So zinc and iron are critical for normal growth, as what I have said earlier, and hematopoiesis and neurologic development during infancy. So babies absorb zinc from breast milk well, and breast milk has a zinc binding enzyme that helps babies absorb zinc through the intestine. So new foods should be introduced in plain and simple form at a time for a period of 5 to 7 days to identify allergic reactions such as rashes, fuzziness, vomiting, diarrhea, or constipation. If there is a positive family history for food allergies, milk, eggs, wheat, and citrus food should be introduced cautiously, and peanuts and peanut butter should be avoided because of the potential for severe allergic reaction. So, as what I have said earlier, hem iron is found only in meat, poultry, seafood, and fish. And hem iron is a type of iron that comes from animal proteins in our diet, and it is more easily absorbed by our body. And other causes of allergic reactions, which is the other causes of fussiness in babies, include diaper rash, food sensitivities, nipple confusion, and low milk supply, and etc. And babies normally fuss for many reasons, such as the overstimulation, discomfort, overtiredness, and etc. So lastly, infants differ in the amount of food they want or need at each feeding. The amount of solid food taken on a feeding may vary from 1 to 2 teaspoon initially to 1/4 to 1/2 cup as the infant gets older. To avoid overfeeding, infants and children should be allowed to self-regulate the amount of food consumed. Only healthy food should be introduced, and it may take 15 to 20 exposures before a new food is accepted. Parents should be cautioned against introducing empty-calorie food simply to provide calories. And the high nutritional requirements for healthy growth and development leave little room for foods with low nutritional value.
Here in Table 12.3 is the sequence of infant development and feeding skills in normal, healthy, and full-term infants. From birth through 5 months, the following are their mouth patterns: suck or swallow reflex, tongue thrust reflex, rooting reflex, and gag reflex. For their hand and body skills, we have poor control of head, neck, and trunk, brings hand to mouth around 3 months. And for their feeding skills or abilities, they swallow liquids but pushes most solid objects from the mouth. From 4 months through 6 months, the following are their mouth patterns: draws in upper or lower lip as spoon is removed from mouth, up and down munching movement, can transfer food from front to back of tongue to swallow. Tongue thrust and rooting reflexes begin to disappear. Gag reflex diminishes, and opens mouth when sees spoon approaching. Hand and body skills: sits with support, good head control, and uses whole hand to grasp objects, or what we call palmar grasp. For their feeding skills or abilities, takes in a spoonful of pureed or strained food and swallows it without choking, and drinks small amounts from cup when held by another person with spilling. From 5 months through 9 months, their mouth patterns are the following: begins to control the position of food in the mouth, up and down munching movement, and positions food between jaws for chewing. For their hand and body skills, begins to sit alone unsupported, follows food with eyes, and begins to use thumb and index finger to pick up objects, or what we call pincer grasp. And for their feeding skills or abilities, begins to eat mashed foods, eats from a spoon easily, drinks from a cup with some spilling, and begins to feed self with hands. 8 months through 11 months. For their mouth patterns, moves food from side to side in mouth, begins to curve lips around the rim of cup, and begins to chew in rotary pattern. For their hand and body skills, sits alone easily and transfers objects from hand to mouth. And for their feeding skills or abilities, begins to eat ground or finely chopped food and small pieces of soft food. Begins to experiment with spoon but prefers to feed self with hands, and drinks from a cup with less spilling. From 10 months through 12 months. For their mouth patterns, rotary chewing. For their hand and body skills, begins to put spoon in mouth, begins to hold cup, and good eye-hand-mouth coordination. For their feeding skills or abilities, eats chopped food and small pieces of soft cooked table food, and begins self-spoon feeding with help.